Hello everyone, and thank you for watching us today for our community update. Today is September 3rd. I know it takes a few days for us to turn this video around, so please know and remember that today is September the 3rd that we're giving this report update with. And again, thank you for joining us. We have several topics to discuss today, and you know the top of our list is always where are we with COVID-19? So let's get started. COVID-19. Yes, last week in the Paris PI, you saw that it said we're in crisis and overwhelmed by COVID surge. And you know it's continuing. I send frequent updates to the medical staff, and the first sentence states the hospital's status is emergent and overwhelmed. So what do those words mean to you as a community? From my perspective, there are two ways that you should understand this. One, service availability. Service availability is reduced. Inpatient elective surgeries, high-risk surgeries that could require a bed, and elective cases that are only available at the hospital due to equipment that is here are all on hold. And that's not just here, it's other hospitals too. Also, there are no beds to transfer to another hospital for those services that we don't offer. The only transfers that we've been able to send out lately have been stroke patients and a few cardiac patients who actually had a cardiac event. So again, there are no beds. We have stood up beds in the hallways in the ER, just like you see on TV at other places. This is true. We have beds in our ER. We're currently boarding 4 patients in the ER who would otherwise be an inpatient in a room. So ER wait times also could even be longer because now we are managing inpatients through the ER because that's where they are. We are seeing more COVID patients now than we have ever seen at any time during this pandemic. So let me say that again. We're seeing more patients now than any time during the whole pandemic. Today we have 23 COVID-19 positive inpatients. Our ER volumes range anywhere from 60 to 85 every day, and 1 in 4, mostly 1 in 4 of those are COVID-19 positive. The state of Tennessee recently released some information that said 1 in 85 people in Tennessee are COVID-19 positive. Our physicians tell us a lot about the Delta variant and the different impacts that it has today. And one particularly that got my attention is on the lungs. So let me see if I can talk about this in words that maybe we understand. There are fewer successes with people on ventilators today. And let's get to the correct word of what a ventilator is. We talk about a ventilator as a piece of equipment, but a ventilator is life support. So let's call it that, life support. So the Delta variant, for some reason and for some people, are causing the lungs to become like liquid concrete. So we all know how thick and non-porous that liquid concrete is, or that concrete that hasn't molded to its form yet is. So imagine that filling your lungs. So you wanted to know the truth about this pandemic, and you just heard that. Crisis, emergent, overwhelmed, difficult symptoms, and life support that is failing patients. And you know, if this wasn't enough, there's one more thing to talk to you all about in our community. When you come to our facility, you see our greeters at our front desk, our registration staff, and basically anyone who asks you to wear a mask at our facility. Signs are posted. Please wear a mask. But you know, my staff is being brutalized by some, not all, but by some in this community. And I think you need to hear this truth as well. We've had to actually call the police and issue a restraining order on someone who really berated us over this and continues to call with threatening phone calls. Please stop this. Please be respectful. We respect you. Please be respectful of differences in opinions and choice. as well as support the decisions that we're making here at this facility and how best to manage this facility. This is not about politics or anyone's rights. This is about the service that we provide, and it's about the safety of our staff and our patients. So please, all I can ask is let's be kind to one another. Please be kind. I really want that message to resonate. Please be kind. I've been very, very truthful with you about our facility and what we see day in and day out. It truly is chaotic. It truly is overwhelming. It truly is crisis and emergent at this facility. I can't tell you that enough over and over again. The people who know me, you know that I'm telling you the truth about things that are happening here. So please know that. Okay, COVID-19. Let's move to the second topic, vaccinations. We're currently at 43% with 1 dose and 37% with 2 doses in Henry County. Vaccines are free. They're free to anybody in this county. And we offer those every Friday. During the month of September, they will be offered every Friday here at HCMC. In the morning from 8 to 10 is Moderna, and in the afternoon from 2 to 4 is Pfizer. Vaccines are most often our first line of defense. They have proven efficacy, and Pfizer was just fully FDA approved. The healthcare industry is overwhelmingly stating and pleading that you think about vaccines because they are viable and a great resource for protection against this virus. Please check with your physicians. Please check out our social media, our recent videos. We have lots of videos out there and some from community leaders just recently. Please look at all of that information. If you have any questions or concerns about the vaccine, please feel free to reach out to us and connect with us. Lastly, I want to leave you with a thought about September. I try to tell you each month what's coming up, and the month of September is Suicide Prevention Month. We have lots of information for our behavioral health out there, lots of initiatives that are going on that we're launching. Please be looking at our social media websites again and catching up with us and follow us. We have lots of services for you. We're here for you as a community. Thank you so much for those of you who've been supporting us. And again, my last message is let's be kind to one another. Thank you so much and stay safe. Thank you.